And I know a lot of you consultant already have experience sending patients to other countries. So today we want to, with MHTC, we would like to introduce Malaysia Hospital. So Thomson Hospital, we are looking at accessible, accountable, and sustainable. The group of TC, we have a hospital in Kuala Lumpur, we have a fertility center, we have a Chinese medicine, and also we have the pharmacy. So 4 entities. Of course, the hospital is the one that we focus. Yeah. And our aim, our mission is to be one of the top hospital in Malaysia, and we started venturing into medical tourism. Yeah. Since like last year. Bangladesh is definitely a market that we look at because first of all, Malaysia, we are Muslim friendly. Yeah, if you come over here, majority of the staff in the hospital are Muslim. Food are all halal, so you feel very comfortable. Second is the pricing. In terms of comparison to Singapore and Thailand, we are quite reasonable price. Yeah. So and of course Malaysia, if you know, Malaysia truly Asia, right? If you come over, you feel that you're a community of Malay, Chinese, Indian, and also a community of Bangladeshi. And third, most importantly, are our doctors. Our doctors are highly qualified, yeah, specialists, and you can actually count on our doctors. Okay, very good. Thank you. So, as I mentioned, we started in Singapore first. I'm not sure whether some of you, the partners, right, have actually collaborated with Thomson in Singapore. So we started in Singapore as a women and child hospital, Malaysia, okay, Kota Damansara, and the others are fertility center. And we also, as a group, recently acquired M3 Hospital in Vietnam. And we actually aim is to be the integrated healthcare system of choice in Southeast Asia. Looking at the hospital, we have 373 beds, 5 fertility centers, 1 gynae and care women specialist clinic, 1 TCM, traditional Chinese medicine, and 1 pharmacy. And we have another hospital in the plant in Johor Bahru, which is very nearby Singapore. It's going to be a 500-bed hospital. These are some of the description of our hospital, established in 2008. Kota Damansara, Selangor. Actually, 160 specialists, yeah, including the sessional and the visiting. So, 2 hospital blocks, 10 OTs, 373 licensed beds. Actually, the hospital are built for 500 beds. Yeah, but so far we operating a license of 373 beds. Recently, we acquired the new 3D Tesla machine, MRI. And we also collaborated with OncoCare, bring in the top oncologists from Malaysia to our hospital. And fertility center, we actually started as a fertility center in 1994. 5 centers around Malaysia, largest IVF lab in Malaysia. Yeah. So these are some of the milestones. We started in 1994. We acquired accreditation, Malaysia, and MSQH local accreditation. Yeah, and I think in 2001, too small. Yeah. So we actually achieved like Malaysian Book of Record for the highest baby in IVF. Yeah. So this is one of the achievements. Those that want to look for IVF, yeah, later you can talk to me. Yeah. So this is all the milestone. So I look at the hospital itself. It's called Thomson Hospital Kota Damansara. Kota Damansara is a place. It's a place where we are located, and we are flagship tertiary hospital in Malaysia. Yeah, as I mentioned, 559 beds, 1,000 parking, 160 outpatient clinics. Our lab is actually automated, 25 critical care beds, one of the largest, not the largest, I think it's the second largest in Klang Valley, which is in KL. It's in our hospital. And next to MR.
Jantung Negara is a premier cardiac Hospital of Premier Cardiac Center of Malaysia. We are located in the heart of Kuala Lumpur City Centre. We was established back in 1992 under Tun Mahathir Mohamad, the former Prime Minister of Malaysia. I'm sure many of you would know him. Yeah. So he is the founder. He is he's a brainchild of his. And today we are more than 32 years old. And this is what we offer at Institute Jantung Negara. We basically have these healthcare services where we are center of excellence for adults as well as pediatric cardiologists. So we do from a very simple health screening under the healthcare services. We do research and development as well as training and education. We train new doctors within the country as well as doctors, cardiologists from abroad. And this is the strength of our doctors and our staff. We have over 180 cardiologists under one roof. We have more than 180 actually. So this data is a little bit backwards. So we have more than 180 cardiologists, both for adult as well as pediatric patients. And these are the number of patients that we treat annually, every year. If you look at the trend, it is always upwards. But there was a little bit down in 2019 to 2020 because of COVID. Other than that, you will see even in 2020 we have treated about 335,000 patients for outpatient treatment and about 19,000 patients for inpatient. And this is the workload of patients that we see. These are for angiogram treatment, which is done in the ICL lab. So the one in yellow on the top line is for angioplasty treatment, which is done in the lab. So we see in 2023 about 11,000 angiogram has been done in IJN, and about more than 3,600 cases of surgical cases was conducted in IJN. So
myself included, so I will try not take too much of your time. So I actually prepared this for a half an hour talk. I will try and not to take too long. If you do have questions, you can ask in the end or even after the event is finished. Okay, so my name is Dr. Afif Ashari. I'm a cardiologist in Institute Jantung Negara. Today I'm going to talk about BD odds or preventing heart disease. So just a bit of outline of today's talk. So just a brief overview of cardiovascular disease in general, particularly for the heart. So talk about heart disease, what does it include, the different types, recognizing the symptoms, the risk factors, the tests that we can do, and towards the end, treatment and recommendations. Okay, so cardiovascular disease. What is cardiovascular disease? So cardiovascular disease is mainly any disease that affects the blood vessel or the cardiovascular system. So if it affects the heart, it's called coronary artery disease. So this is the one that causes heart attack, or sometimes it can cause heart failure. These are the two common cardiac conditions that you worry about. Brain can cause stroke. In the limbs, in diabetics especially or smokers, they can have peripheral arterial disease. You can see the picture. At the bottom right, there's the leg that's red. Sometimes these are the problems where the wound is difficult to heal. Sometimes they may need, worst case scenario, amputation or sometimes even lead to mortality. But the focus today is more for heart disease. Okay, so the process of cardiovascular disease is called atherosclerosis, where there's build-up of plaque in the blood vessels. So in a way, it's almost like a plumbing problem where the flow gets blocked. So it's a very slow process, and it can be accelerated if you have more risk factors. So we'll go through some of the risk factors later, and this is the main process of cardiovascular disease. Okay, so like we are focusing on the heart again. I mentioned that the narrowing can happen, and if the plaque or the plaque in the artery gets ruptured, so it can lead to the thrombus or clot, and this will block the artery, and this usually triggers a heart attack. So moving on from there, myocardial infarction is a medical term, but it's for heart attack